Hi, everyone. Welcome to Just Keep Swimming. I'm your host today, Angela Rastegar, CEO of Sunfish, and I am delighted to be joined by the fabulous Dr. Jackie Ho of Reproductive Partners. Dr. Ho completed her training at USC here in Los Angeles and practices here in LA as well. She has worked with thousands of patients over the years and has actually been recognized as a top doctor by Los Angeles Magazine. So we are thrilled to have her. Welcome, Dr. Ho. How are you today?
I'm great. I'm happy to be here, Angela. So great, really great to meet you.
Thank you. I know a lot of people have questions about what reproductive endocrinologists do. So let's start by setting the scene for our listeners. What is happening in your clinic today?
So we have a really, every day is exciting. There are always procedures and things happening. So in the clinic itself, we do ultrasounds in the morning. So we monitor patients going through treatment. So various types of treatment, including getting their ovulation induced, intrauterine insemination cycles, IVF, egg freezing cycles, all of that. We monitor patients very frequently. So we'll do ultrasounds in the morning, we'll do procedures. We'll monitor pregnancies as they're coming along. So we've had some pregnant patients come on to check in on their pregnancies weekly. And we do procedures. So I just came from an egg retrieval. We retrieve lots of eggs for a patient freezing embryo. So hopefully she'll do well. And so that is all happening at the same time.
Definitely, you keep your days very busy. I also always like to start our episodes with asking everyone what is their favorite family success story? So a couple or family that really stands out in your mind.
It's hard because I feel like everyone's journey is so unique, and I feel like every like month I have a different favorite story based on like a great patient I have. What I do have a couple like miracle stories that feel like miracle stories. One stands out, was a patient with breast cancer, who had two recurrences, who was not allowed to carry a pregnancy, so needed a surrogate. But unfortunately, she had undergone several rounds of chemotherapy, so didn't have very many follicles, and also didn't want to be exposed to too many medications. So we did a natural cycle, which I don't actually do very often, a natural IVF cycle, where we retrieved actually just one egg, because that's all she ovulated for that month. We created one embryo, and she, found a gestational carrier for which we transferred into. And I was like, what, nervous, because this is the one, potential embryo. And she had this very short window for which she was able to retrieve, and create embryos, or one embryo. Fortunately, the transfer was successful. Her surrogate got pregnant and she had a live birth. So this is truly incredible. We can make this happen, and the patient and her family are all doing really well.
That is truly an incredible miracle story. And I definitely understand it's hard to pick your favorite child,
Yeah.
literally, amongst
Yeah.
when you work in this industry. All right, let's talk a little bit about IVF. There's
Mhm.
a lot of myths, and we try to separate fact from fiction. What do you think is the biggest misconception about doing IVF?
I think there are a lot of misconceptions about IVF. One of the big misconceptions about IVF is that you're high risk for twins, that everyone does IVF has, twins. And I think that's actually the opposite. So for most modern like IVF, we are actually doing single embryo transfer, because for many patients, we are doing genetic testing of the embryos, and that success rates are so good that we're transferring one at a time. So the actual risk of twins, when you're transferring one embryo, is actually less than 2%. So it's very rare. So we are able to achieve really good success rates with good obstetric outcomes as well, and a very low rate of twins.
That is a great one. In terms of your advice as people think about preparing for IVF for females, what is the best thing they can do to prepare for IVF?
So I think about it in different ways. So I usually counsel all my patients the same way. So from a lifestyle perspective, living a healthy lifestyle is really important. So um, avoiding things like cigarettes, drugs, minimal alcohol. Diet wise, just eating healthy is really good, and being at a healthy weight is good. A Mediterranean type diet, which is higher in vegetables, fruits, lower, high in healthy fats, and lower in processed foods, is thought to be potentially helpful. and having taking their prenatal vitamins, trying to reduce stress and get good sleep. Obviously, these things are not all attainable for everybody, but trying for this. I think emotionally preparing for IVF is one of the most important things. Building a support system is so crucial. The journey is very emotional. There are lots of ups and downs, and the journey is not always straightforward. So having your partner, or if you don't have a partner, having close friends or family, or even a therapist if it's really needed, can be really helpful, because this process can be, it's not always, but it can be emotionally draining for patients. So having resources and a support system is so important. Another thing that's important is kind of having realistic expectations. So usually patients should ask their doctors what their realistic, chances are. The chances of success can vary by things like age, your egg supply, any treatment cycles in the past. So if your doctor can go, review and give you specific numbers, it'll help keep your expectations realistic so that hopefully you'll be pleasantly surprised along the way. But, there's always, there's attrition through this process of IVF. And sometimes that's really hard for patients. So understanding what the possibilities are makes it more doable. And then lastly, I think, preparing financially. Many people have, some people have coverage and a lot of people don't, unfortunately. So just kind of understanding the costs and preparing for that and making sure it's, doable for your family is important as well.
I definitely agree on preparing with a support system or setting up your support system in advance. And for us at Sunfish, since we help people obtain loans and financial resources, a lot of the work we do beyond that ends up feeling a bit like we become a part of that support system, because the financial cost and financial stress can be a really big part of this journey. So I absolutely love that answer. We also offer a cost calculator on our website so people can estimate the total cost of their journey depending on exactly what they're doing, if they're using an egg donor, etc. So that all makes sense. Mediterranean diet. We just are working in a new office space that gives us donuts every week and bagels once a week too. So have been trying to resist that. But that is a perfect answer. In terms of male partners going through IVF or providing the sperm source, anything different to what you just described that would help a man prepare for going through IVF with their partner and providing a sperm source?
Yeah, I think a lot of the same things apply, like the healthy lifestyle, avoiding cigarettes, drugs, minimal alcohol. Avoiding something specific to men is avoiding excessive heat. So like hot tubs, saunas, hot baths can be detrimental to sperm production. So we counsel male partners to avoid that while they're undergoing treatment. And I think, the best they can do is, providing emotional support to their partner, whether it's, they can come to appointments, they can help with their injections, they can help advocate for, with the patient, the female partner during this emotional journey. Those are all things that they can be, doing to be helpful during the IVF process.
Beautiful answer. We just launched a partnership with Tara Lipinski and her husband, Todd, who shares a lot of great advice from the male perspective as to how to do that last piece of providing emotional support on the journey. I agree that is not to be overlooked. Okay, so let's dive in. The next section that we wanted to talk to you about is a little bit behind the scenes, really understanding the point of view of a reproductive endocrinologist. So maybe you can just tell us, what is a reproductive endocrinologist and why did you choose to become one?
So a reproductive endocrinologist is somebody who specializes in exactly what it is, so reproductive endocrinology and infertility. So we can see patients with a variety of reproductive disorders, endocrine disorders, so things like polycystic ovarian syndrome, amenorrhea, endometriosis, things like
uterine
that, as
abnormalities.
well as,
Yes.
Mullerian anomalies, like you're born with, we could treat all those things. There are pubertal disorders as well, like not less common, but we see those as well. And we can also see patients with infertility, who desire to pursue treatment or work up in treatment, and also patients who are interested in fertility preservation. And the pathway to get to reproductive endocrinology is, 4 years of medical school, a 4-year OBGYN residency, and then a 3-year fellowship in reproductive endocrinology and infertility.
Great. And why did you choose to become an RE?
In general, I decided I wanted to do women's health through OBGYN because I think women are fabulous to work with. I think they're like the backbone of, basically society, and they're great patients. And I find, women's health to be incredibly important. And within OBGYN, REI really called to me because I think all aspects of obstetrics and gynecology are very important. But the relationship you can, build with a patient during the fertility journey is really incredible. It's very emotional. But the potential upside and outcomes are amazing. And to be able to sort of help patients build a family, I think is very impactful. And rewarding. So that's why I decided to do it. And the technology is really great too. I mean, I think our field is really exciting. There's always, things being developed to improve outcomes for our patients. And, there's, from improvements in the lab to things like CRISPR, where you can do gene editing, which is not like in full use at this time, but all these advancements in the field are extremely exciting and relevant to our practice.
It's really clear to me from having known you for a while now and worked with your clinic very closely that you are extremely passionate about this field and your patients. And I love that last point you just touched on. So what is a new advancement, either in IVF technology or protocols, that can benefit patients that you're most excited about that you may have seen or come across recently?
There's a lot of things, but I think artificial intelligence is sort of making its way into the REI field, like it is with the rest of the world. I recently went to ASRM, which is our National Reproductive Conference, and there are various applications. So if you give the AI algorithm enough data, it can help predict things accurately. So one way it can be used is predicting the best time for triggering for egg retrieval. So when we optimize the number of mature eggs, which will optimize likely the number of embryos and whatnot for a patient. And then it could potentially be used for things like sperm selection, for ICSI, or even embryo selection. Obviously we're doing a lot of genetic testing of embryos, but even between genetically tested embryos, if you have multiple to choose from, maybe the data on like how they're developing can be helpful as a selection tool as well. So lots of really interesting applications.
100% agree. Our team is very passionate about AI and predictive analytics as well. We're actually utilizing a lot of that to help our members, our patients that work with Sunfish, predict their chance of success. And just so our listeners know, some of the things that you talked about for the last few years, a lot of those processes on when to trigger, which embryo to select has been done by more or less by hand, by a lab technician or an endocrinologist actually looking, or an embryologist looking at those biomatters with just their eyes. So there's a lot of advancement in technology and predictive analytics that is going to hopefully dramatically improve results as it advances. So you mentioned a little bit about your clinic, Reproductive Partners, which is here in Los Angeles with multiple locations. Why did you choose to work at Reproductive Partners?
So I chose to work with Reproductive Partners. One major reason was because I think all the physicians are fabulous. I respect them. I think they're really smart. They're really good doctors, and they practice good medicine, good ethical medicine. And I think in the field of REI, you can get kind of, it's not as like regulated or rigid as some other fields of medicine. But I think in general, like all the doctors practice good medicine. They have good reputations. The lab is really good. So I'm very happy with how my patients have been doing with the lab. So that's another reason. We have good pregnancy rates, which I think is great. And And I also love in Redondo Beach, our staff is fabulous too. I mean, I just, going through fertility treatment, like I think is hard for a lot of patients, and having a team that's really, fun and positive and like, supportive during that journey is important. And I feel like we do have that collegiality and atmosphere, which I think is hopefully great and helpful for our patients.
I've definitely felt that environment having come to a couple of your locations. It really feels like a big family. So it seems like an amazing place to work. In terms of IVF clinics, there are so many, they come in so many sizes, different protocols in terms of how they practice. Generally speaking, I know this is a big question.
Mm-hmm.
Do you think there's any misconceptions about IVF clinics? And if so, what are they?
In terms of, I don't know, I guess misconceptions about IVF clinics. I mean, I think that
For
it's hard.
example,
I mean, yeah, go
yeah, I'll
ahead.
just give a couple examples. Sometimes I think people don't, when we talk to patients, they're curious around like how the pricing is determined. Are the doctors actually, for example, being forthright about my chances of success? So really recognizing that while everyone's there to help and help you get pregnant, these clinics are also a business. I sometimes get questions about like, how does it work? How are decisions made? That might be an area where people might have curiosity about what's happening behind the scenes.
Yeah, I mean that to your point, that could be true. I mean, I think that I mean it is a business, but I think that there I would say largely most of the community are most of the physicians are good and they're practicing good medicine. I think the problem is I think, sometimes the communication style of different providers may be, not suited to everyone. So they think, oh, like they, it may, maybe certain clinics don't understand me or like they don't get my journey. And I think it's hard, like there are various, everyone has
Personalities.
their own, yeah, everyone has a different
Yeah.
personality. Finding a match is important. I don't, most of the doctors I think are really good. Um, some may practice outside of what's considered like, kind of usual and standard. And maybe that's better for some patients. And maybe, finding that fit is important for your journey.
Yes, Dr. Ho, I think you're touching on a really important point. And just like so many other fields of medicine, if you're getting a knee surgery or any other type of procedure, making sure that you connect with your doctor and trust them is
Mm-hmm.
so huge. So I love your point, Dr. Ho, on just getting to know the doctor, making sure you feel comfortable with them on what and might end up being a long journey. Hopefully you're successful on the first try, but for some people it does take years. So I
Mm-hmm.
think this channel just keeps swimming, and some of the content we're creating where people can get to know you and your personality is so helpful so they can get a sense of that in advance. And I know a lot of clinics, including yours, also will do webinars and additional resources so people can get to know their doctor and find the
Mm-hmm.
one that is the right fit. So I think that's a beautiful answer. We just have two more questions here
Mm-hmm.
for you. There's a lot of talk around why there's so much demand for IVF clinics. So can you share a little bit about your thoughts of infertility being on the rise and what might be some of the causes of this?
Yeah. So um, the WHO actually released newer statistics. I mean, previously, I think the statistics were that worldwide, about 1 in 8 couples experience infertility. And now they've released statistics that it's 1 in 6. So clearly there is some changes, are changes happening. There are, various reasons why this could be happening. Um, Many of which could be related to, a lot of women are delaying childbearing. So they're not having their first child in their 20s anymore. They're sort of building their careers, maybe not meeting their partner until a little bit older. And so that, and infertility is real, can a lot of it is related to age, female age. So a delay in childbearing can play a role. And for example, like a lot of physicians, don't start to, having children or trying until they're done with their training, which I know, from personally speaking, takes several years. So you're not starting
Mhm.
to at least early to mid 30s or even late 30s, depending on when you started your career journey. And about 1 in 4 physicians in one study were shown to have infertility. So that definitely can play a role. There can be things like, there's some thought that endocrine disruptors in the environment can affect both egg and sperm health. So that can be found in like plastics and pesticides. So that may potentially play a role. I think the demand for fertility care is increasing because more people are interested in accessing it as well. So there are other like non-traditional sort of ways of building a family. So in the LGBTQ community, there are same-sex couples that want to build families through like egg donor and surrogacy for same-sex male couples, and for same-sex female couples through IUIs or IVF or reciprocal IVF. And then a lot more women are interested in becoming single mothers by choice. So this is like all growing, which is really exciting. A lot of people are freezing eggs too, and this is becoming a lot more common and accepted. And many, some employers are providing benefits, not all. So I think more people want to access this, and I think it's great.
Yeah, definitely a lot of societal and environmental factors contributing to that. LGBTQ for us at Sunfish is a big one right now. About 40% of our customers identify as LGBTQ. So that is huge. The last thing I would just add that we've seen is kind of destigmatization, and a lot of like the conversations like what we're having right now can help with that, where people are realizing this is normal. It's normal to talk about it. If you're struggling, there are resources that can help. So that is all really helpful information for our listeners. Last question that we always like to end on is, what about the future of fertility most excites you?
I think just any of the developing technology is really exciting. So, there are like experimental things that are like in the works that could be really exciting. So, for example, CRISPR gene editing. Not that I like think it's like going to be needed for everyone. That is something where if you have some serious disease, and as it stands now, a lot of what we'll do if someone doesn't want to pass on a genetic disorder is we'll do IVF, select embryos that aren't affected. For some people, CRISPR and gene editing may play a role in like editing genes that could prevent disease phenotypes in patients that do carry, have a specific genetic disease. Um, there could be a role in like, or there in it's experimental, but like there's like the ability to use nuclear DNA from a parent and transfer it, or from a female, like from an egg and transfer into another egg, like a donor egg. If someone doesn't want to pass on like a mitochondrial disorder, and the egg itself carries all the mitochondrial DNA, so you're almost certainly likely to pass it on from mother to child. But if you can use a different egg, like a donor egg, but the same, be biologically related, that's exciting. I mean, obviously this is all experimental, but there's like just you think these things sound like sci-fi to the general population, but at some point, like there, who knows what the option, the technology is really growing, and the ability to expand options for patients is growing. The ability to improve outcomes, just like will get better at biopsying embryos and understanding embryos, and all of this is improving to hopefully make optimize pregnancy rates eventually for
Yeah,
patients.
reduce the chance of disease for your children. That last example you shared, I believe, has already been done in the UK. So we are living in the future.
Yeah.
Well, thank you so much, Dr. Ho. This has been so informative. Is there anything else you'd like to end with before we wrap up?
I don't think so. I mean, thank you for having me. And I'm really grateful for what you guys do for patients. I think it's really important in helping patients kind of achieve this, their goals, and helping them along, with this fertility journey. I mean, I think it's really hard, especially if finances are a barrier. You can help make it a reality, which is really amazing.
Thank you for saying that. We absolutely love working with you in your clinic. And I agree, the financial piece tends to be one of the most stressful and biggest barriers. So we're really happy to be able to play a role. And if people want to find you, you're right here in Los Angeles at Reproductive
Yeah.
Partners. So Thank you so much. We'll add your contact info to these posts, and looking forward to hopefully working on some shared journeys together.
That would be great.